Hello, everybody. My name is Emily Kosik, and I'm the Knowledge Manager for the Canadian Institute for Public Safety Research and Treatment. I want to welcome you to our talk today, Finding a Way Forward, the Unexpected Feeling of Growth that can come after trauma. Before we get started today, there are a few housekeeping items that I want to go through. So first, all attendees are in listen-only mode. This is to limit noise and feedback. Secondly, today's session is being recorded, so you will be sent a copy tomorrow. So if you miss anything, you can watch it again. Next, the GoToWebinar launch window can be blocked by some organizations. So if you're having trouble hearing or seeing us, you may need to join using your phone. Lastly, we will be looking for audience questions at the end of the session, so please send us your questions through the questions box or be ready to raise your hand to ask your questions. Now, I am pleased to introduce our speaker for today, Dr. Samantha Horswell, a registered doctoral psychologist with experience working with public safety personnel. So I am going to go ahead and turn over the screen sharing to you.
Thank you.
And I'll let you get on with your presentation.
Okay, wonderful. Thank you, everybody, for joining us today. Okay, does that work on your end, Emily? Does that look right?
Yeah.
Okay, excellent, great. So my name is Samantha, as I've been introduced. I'm going to tell you a little bit about me, and then the bulk of today's presentation is going to be about trauma and post-traumatic stress disorder and post-traumatic growth. So I received my PhD from the University of Regina. I'm a clinical psychologist working in Saskatchewan. While I was at the University of Regina, my research was focused on police and post-traumatic stress disorder in the province of Saskatchewan. I'll talk a little bit about what my research was. Working in this area sort of before CIPSRD organization was developed. So very exciting that all of this research has been done since that time. I did my residency in Calgary at the Operational Stress Injury Clinic there, where I focused on RCMP, active and retired, and military veterans, active and retired, and did more work in trauma and trauma treatment and assessment. I'm now in private practice in Saskatoon, where I work mostly with work-related stress injuries, so largely in the realm of public safety and first responders, also some other workplace traumas and emergency room nurses, these sorts of things. I'm currently on maternity leave, so I practiced my presentation in front of my little munchkin yesterday, and he gave it thumbs up, so hopefully you guys appreciate it too. If you hear crying in the background, my lovely husband is managing the baby today, so send him good nap vibes upstairs. So today I'm going to talk about first trauma and post-traumatic stress disorder, a concept that probably most of you will be familiar with. I understand that there will be public safety personnel, treatment providers, researchers who are participating in this today. So for some of you, this will be old information. For some of you, it may be more new. I'm going to talk briefly about treating trauma in public safety personnel. And then I'm going to talk about what post-traumatic growth is, and more importantly, what it's not. When people hear about this for the first time, there is this perception that we're asking you to look through the world with rose-tinted glasses and to minimize the trauma that you've been through. And that's not our goal with post-traumatic growth. So I almost want to spend as much time talking about what it isn't as what it is. Then we're going to talk about whether we can foster post-traumatic growth on purpose, whether this is something that passively happens to us or whether this is something that we can actively encourage. And depending on time, I'll give an example or two of what I see in my practice. And there'll be time for questions at the end. So trauma and post-traumatic stress disorder. When we think about what a trauma is, chances are good something already jumped into your mind. We have a very specific set of criteria that we talk about when we're diagnosing a disorder like post-traumatic stress disorder. Generally, we're talking about witnessing death, witnessing or experiencing severe injury, or feeling like there's a significant threat to your safety. So we may be talking about things like car accidents, assaults, coming across a car accident or participating in one yourself. For public safety personnel, it's kind of split down the middle in terms of whether you're witnessing it or whether there's a threat to your personal safety, depending on what the type of job is. A job like policing, you may almost witness more than you experience your own safety threats. In a job like corrections, you may feel that there's actually more threat to your safety day to day. So it depends on the type of job. One of the things we also know about trauma is that exposure to details as part of your job over and over and over again can also cause a trauma response. So reading files consistently or hearing colleagues tell details of really graphic stories or we actually see post-traumatic responses in journalists who report on situations. So witnessing, experiencing, or hearing about details of trauma over time. And although we think of trauma in terms of one major event, with public safety, it's much more likely to be an accumulation of trauma over time. So it's not just one event, it's often there's a straw that represents years and years of trauma that's accumulated. Probably unsurprisingly to all of you, public safety personnel are more likely to experience a trauma than the general population. The general population, we have research that 85 to 90% of people will experience a single trauma in their lifetime. So trauma is something that a lot of people go through. Again, car accidents, sudden loss of life in their family. With public safety personnel, this can be a daily experience. For some types of public safety personnel, you may experience 3 or 4 potentially traumatic events in a single shift. And for other types, certainly we would expect within the first year of your job, you would experience a potentially traumatic event. So trauma is a normal experience for public safety. Exposure to trauma sometimes results in something that we call post-traumatic stress disorder. This is a psychological mental health condition that we don't always experience after a trauma. In fact, the vast majority of people who experience a trauma, a single trauma, will not develop PTSD. However, when you do, it is because of exposure to a trauma or to accumulated traumas. Again, that idea that one by itself sometimes doesn't do it, but if you experience 10 in a row that are similar, sometimes it can result in a mental health condition. And what we look for is 4 symptom groups. So again, some of you will know this, but review just in case you don't. First off, we look for something called intrusions, re-experiencing the trauma as if it's happening to you right now. This will show up in intrusive memories, it'll show up in nightmares, it'll show up in flashbacks for some people. So basically the memory of what happened won't leave the present day. And of course, because that's so unpleasant to experience, the second symptom that we tend to see is avoidance, avoiding reminders of the trauma, avoiding the place where the trauma happened, avoiding talking about it, avoiding thinking about it if you can. And for some people, avoiding feeling any emotions at all, just in case you experience something scary. With trauma, we see negative changes in the way that we think about the world, the way that we think about ourselves or other people or the world. You might start to feel like the world is an unsafe place, or people are essentially bad, or bad things happen to good people. There's lots of different ways that trauma can shift the way that we see things, and tend to experience more negative emotions, not feel positive feelings. And then lastly, we look for changes in reactivity. So there's a classic startle response that happens. People might find that they're sleeping less than they normally do, or their sleep is really disturbed, they're more irritable or angry. So generally more reactive to the world. And so we need symptoms in all 4 of these groups in order to diagnose post-traumatic stress disorder. There's other types of conditions that have different kind of types of symptoms as well, but when we think about PTSD, these are the 4 that we're looking for. And again, probably no surprise, rates of post-traumatic stress disorder are higher in public safety personnel than the general population. Depending on the trauma, the general population tends to experience PTSD anywhere between about 5 to 12% after a traumatic event. For public safety personnel, it is a lot higher. So I'll talk first about the research that I did when I was in my PhD program at the University of Regina. I looked at police officers' rates of post-traumatic stress disorder in Saskatchewan, both RCMP and municipal. And so what we found in this study, which captured about 1/5 of the officers in the province, there was really great participation there, was 25% of RCMP probably had PTSD based on surveys we sent out, and 12% of municipal officers as well. So again, higher than that civilian percentage that we tend to see. After that research was done, there was research done by the CIPSRC group looking at mental disorder symptoms in public safety personnel more generally. So not just police, but also firefighters, corrections, paramedics, communications officers. And what they found is that PTSD was significantly higher than we would see in the general population across all of these groups. So for municipal police, about 20%, RCMP about 30%, correctional workers 29%, firefighters about 14%, paramedics about 25%, and call center operators about 18%. So some variability across different professions, which there's a few theories about why that happens. Often has to do with the type of trauma you're exposed to, the type of duties that you have. but across the board, higher levels of PTSD than in the general population. Not everybody who experiences trauma goes on to develop PTSD, of course. So we have done a lot of research into who develops post-traumatic stress disorder when you've experienced a trauma. The answer is not simple and the puzzle is not complete. So I can't take any particular person, look at their personality, look at their life, and say for sure that after a certain type of trauma, they're going to develop PTSD. There's still an element of randomness, circumstance, and things that we can't predict. But we do know that things have settled out into 4 main reasons that someone may be more at risk for developing PTSD. First, we look at pre-trauma risk and resilience factors. So before a trauma even happens, or before a person gets into a public safety career, they're a person going into this experience, and as a person they have things that they bring forward as strengths, things that we all bring forward as potential weaknesses in different situations. So we know that personality type can influence whether a trauma is stressful for you. People who are more open to experience, more accepting of the world around them, people who are more agreeable, may go into a traumatic event and come out the other side a little bit more well. People who have a difficult time tolerating uncertain situations. So if you think about the future and you feel stressed because you don't know what's going to happen next, tend to be more likely to experience trauma as stressful. And then there are factors like, whether you're on shift work and sleeping at all, whether you tend to use alcohol more often than you should. And so with these different characteristics, you may just be slightly more at risk for developing PTSD down the road. The type of trauma definitely matters as well. There is more in the civilian population, but there's growing research in the first responder population as well that the type of trauma is linked to whether you'll develop post-traumatic stress disorder. So in the general population, for instance, people who experience an assault like a mugging are less likely to develop PTSD than people who experience an assault like a sexual assault. And so the type of trauma tends to link towards whether you develop PTSD or not. People who develop or experience natural disasters are less at risk than people who experience human-caused suffering. So if something random happens in the world, that's a different risk than if a human does something awful to you. This holds up true for first responders as well. So if you come across a car accident fatality, that is less likely to cause PTSD than if you are involved in, say, child exploitation work. And so the type of trauma very, very much affects whether you develop PTSD. And then after trauma happens or after trauma accumulates, post-trauma risk factors and resilience factors are also important. So with this, we look at whether you have social support, whether you have people that you can talk to, or whether you feel quite alone and isolated in your experience. Whether you perceive your organization to have been helpful for you, to have provided support, or whether you perceive your organization to have been unhelpful or perhaps actively hostile in your recovery. Things like whether you exercise, whether you have a healthy lifestyle generally, again, alcohol, substance use. A lot of it comes down to that social support and peer support. So if you have good personal life support in your family and your friends, or if you have peers you can debrief with, or if your organization offers debriefings, these things can be very helpful in reducing risk for PTSD. And then lastly, mental health support. So for some people, you'll actually be connected to a therapist before the trauma happens, which is helpful. You can go talk it out. You can learn what to do in the short term in order to reduce your risk. For other people, there's a lot of stigma still about receiving mental health, not sure how to access it, which I'll talk about shortly here. And access, of course, is difficult depending on where you live. Now, the good news is we can treat PTSD. It's hard to imagine feeling normal or good if you have PTSD, but as a psychologist, the good news here is that the vast majority of PTSD is very treatable. Most of what I do in my work is treating PTSD, and the reason that I'm able to experience other people's jobs through stories of trauma is knowing that on the other side, the vast majority of them get better. So there's a lot of hopefulness that if you're able to access good treatment and feel good about your connection with your provider, that the majority of your symptoms can reduce and you can go back to a life that feels content for you. We have lots of different types of treatments. There's 4 major avenues supported by the research. There's a type of therapy called prolonged exposure, where again, that memory is stuck as if it's in the present tense. And so much like watching a horror movie, if you watch it 150 times, it starts to get boring, starts to stop being so scary. We tell the story over and over again until that memory subsides. There's another type of therapy called cognitive processing therapy, where you talk about the trauma once or twice, but you focus more on how it's changed your life, the impact of that trauma. We grapple with those ideas. Say the trauma has taught you that people are inherently bad. We tease that one out and see if that's completely true, or if there are areas where you know people are actually good. Try and bring the balance back into your life when trauma tends to make it very narrow. There's a type of exposure therapy called eye movement desensitization and reprocessing, which is a more neurologically based treatment that some providers offer. And then for some people, pharmacotherapy through a psychiatrist or family doctor is indicated as well. We have some good treatments here as well. So the punchline that I really want to sell you with the PTSD piece of it, although it's not the focus of today's presentation, is that we can treat PTSD. There are treatment providers across Canada who are very good at doing this, who have specialized training in doing this, psychologists, social workers, some psychiatrists, and we are able to see good benefit even in complex and severe and accumulated public safety professional traumas. Very briefly, if this is brand new information to you that there's treatment for PTSD, you may be wondering how to find treatment. Often your benefits will cover a registered psychologist or social worker, so that's a place to start. However, in Saskatchewan and in many other provinces, workers' compensation covers mental health injuries experienced through work. We have new legislation that a mental health injury is a workplace injury. So if you're eligible for workplace workers' compensation in Saskatchewan, you file a W-1 form, they'll connect you with a psychologist. For RCMP and Veterans Affairs, treatment is covered through the organizations, through community psychologists, or through operational stress injury clinics across Canada. And we have a wonderful online therapy program through CIPSR, PSPNet, which is relatively new and built on very, very solid research through the University of Regina. And so this is an option that is relatively quick, free to access, and extremely well supported by research as well. Okay, so that is a very quick summary of post-traumatic stress disorder. It's a day-long workshop and it's also about PTSD, but that'll give us the foundation for talking about something called post-traumatic growth. To me, the story is already somewhat satisfying before we get to this point. And again, that's because of the work that I do. You experience a trauma as part of a job, you're serving the public, you've given so much of yourself, you've experienced trauma and developed post-traumatic stress disorder. You're connected with a provider. We go through an empirically supported treatment and you come out the other side with less PTSD symptoms. That's satisfying in itself as a provider. But in the 90s and in the early 2000s, researchers began to articulate that for some people, the story doesn't stop there. For some people, things continue to either improve or change. It's not just a return to baseline, but actually growth. The foundational article, this research was really begun in the 90s. In 1996, the first paper came out, but 2004, this paper came out by Richard Tedeschi and Lawrence Calhoun out of the States, and they summarized their concept of post-traumatic growth. They did a review of the research that was starting to talk about this in cancer survivors, in motor vehicle accident survivors, in natural disaster survivors, and everybody was talking about a sense that for some people, going through a trauma actually improved their lives in some way. And remember, I'm going to return to what post-traumatic growth isn't, but that concept that going through a trauma, you can come out the other side and feel that something has changed for the better. This really changed how we look at trauma in the research. It certainly changed how treatment was focused when we talk about post-traumatic stress disorder. Of course, as I've kind of alluded to, reducing PTSD, getting rid of PTSD symptoms is a valiant goal in itself and absolutely worth your time. But isn't it something if we could actually help people to feel that their lives are moving forward, improving, growing in some way because of the trauma that they've experienced? And so research began to capture the concept of growth and to think about whether we can harness this actively in therapy. Again, is this a passive concept or is this something that can be harnessed? Before I talk about what post-traumatic growth is made of, I'm going to talk about what it's not made of. The first time that people hear about post-traumatic growth, I think very understandably, there's often a knee-jerk response of disgust or resentment or shock. I am not asking you to be happy that you experienced a trauma. I am not asking you to look at your trauma as a wonderful gift that the universe gave you. There is absolutely no looking on the bright side when it comes to post-traumatic growth. And we also don't want to minimize what you've been through. Other people have had it worse. I just need to stop thinking about it and I'll be fine. So what we're not doing is taking something awful and trying to package it as something good. There's a whole soapbox I could hop on about toxic positivity and trying to just move past it and don't worry about trauma. It's really not so bad. And well, you do good things, so you might as well just not worry about the trauma experience. No. In order to arrive at a sense of post-traumatic growth, if this is in the cards for you, we really need to acknowledge that trauma is awful. Trauma is hard to go through. It's okay not to want to have experienced it. It's okay not to have known what you were getting into when you signed up for a public safety career and have to reconcile that now. And it's also very, very normal to go through a trauma, develop post-traumatic stress disorder, and have that post-traumatic stress disorder treated and just kind of end it there, feel really good that your mental health condition is no longer diagnosable, you've recovered from it, and good. Similar as we'd expect from cancer treatment, for plenty of people, having a diagnosis of cancer, receiving cancer treatment, coming out the other side without a cancer diagnosis is grand. It is not necessary to say, well, what a great experience for me. And so if you have had PTSD treatment and what I talk about next is not something that resonates for you, don't worry, that's not bad. If you suspect that you have PTSD and you're anticipating going through treatment, just look towards reducing the symptoms in the first place. But for some people, probably more people than we know and a higher proportion than we used to know, post-traumatic growth is something that is actually possible. That 2004 paper gave a great analogy of what post-traumatic growth is when they were starting to look at the process of trauma. They used an analogy of a community that goes through an earthquake. When an earthquake happens, foundations of buildings are shaken, they're cracked, sometimes the whole building comes down. The physical structure of the world changes when an earthquake happens. And this is very similar to how people describe trauma and post-traumatic stress. When they go through a traumatic event and develop PTSD, one of the hallmark pieces of it is that your understanding of the world completely changes. Again, you might have not really thought too hard about it, but generally not thought the world was horribly unsafe, but now have this belief that the world is completely unsafe all the time. You might worry about your kids leaving the house, or you might be afraid of your partner going in a car and driving downtown because you just know that every driver is bad and all people are bad. So the foundation of our world gets cracked and gets damaged. And this is usually not very helpful for us. So just like buildings' foundations being cracked will lead to more structural problems down the road, or perhaps the building comes down altogether. Having these rigid beliefs that the world is bad, unsafe, that other people are bad or unsafe, that you are damaged in some way, doesn't tend to lead us to healthy growth down the road, or even just well-being down the road. So going through treatment is very similar to the physical rebuilding process. It's perfectly fine if you have an earthquake to clear out the foundation, put a new foundation in, rebuild your house. Excellent. That's really a wonderful goal in treatment as well. But some communities will come away with a better understanding of how to build buildings that are earthquake proof. So they'll have different building plans that come into place. The community will rally. It's not that the building will perhaps withstand all future earthquakes, but it may be more resilient to them. And so, in this way, post-traumatic growth can be a process of learning, reintegrating. A trauma happens, it shakes your foundation, and you build a stronger foundation on the other side. And so from this, they and research that's happened since 2004 have put together 5 different areas that people tend to talk about post-traumatic growth. Now, this has been summarized from community members. There's a lot of research on public safety personnel, mostly out of the States, starting to come in Canada as well. And what we see is these 5 areas, and what I see in my clinical practice is 5 areas that people will start to identify that things have changed for the better after a trauma. Again, you don't have to experience all of these or any of these. You may experience all 5 of these. I'm going to talk about each of them briefly. Personal strength is the idea that coming out the other side of a trauma, you may have a better understanding of what you're capable of, a better understanding of the kinds of things you can withstand, of your own personal resources. You feel more fully that you are capable of getting through difficult things. And often I'll hear this in terms of people saying, you know, if I can survive this, I can survive anything. So it really does sound like I've done this impossible thing. I feel very proud of myself, and here I feel like I can move forward and do hard things moving forward too. Appreciation for life is something that I see quite often in public safety personnel. This idea that bad things happen, hard things happen, but life can be okay, and the life that I have is really wonderful. I've built a good life for myself. Built a good life in terms of family, in terms of career, in terms of all kinds of things. Just the life that I have is precious, and trauma highlights that. Relating to others is strengthened relationships that can happen on the other side of a trauma. So the earthquake analogy, and maybe the community comes together, community being your peers, community being your coworkers, community being your family, and sees that you're struggling and helps you rebuild. Community can be your organization as well. Maybe your organization really supported you in a way that you weren't expecting, or provided resources for you and made it painless. Relating to others can also be relating to future people that you help in your job. So if you learn something from an investigation and are able to apply that to your relationships with future clients, future victims, then this can be a really strong satisfaction area as well. Some people experience spiritual or philosophical change. So this was originally designed as a concept of almost religiosity. So for people who are religious, going through a trauma can shake that sometimes. Do the work to figure out how it integrates into your religion. Your spirituality can come out the other side stronger. But bigger than that, we actually think of it now in terms of just general philosophy on life. How do you believe the world is? How do you believe humans are? And how do you make sense of this life that we have to live? And going through trauma, again, can shake all of our understandings about ourselves. And if you do the work, can allow us to develop stronger and more comprehensive understandings of how the world works for us. And the new possibilities, this is one that I'll give an example about down the road, but in first responding work, I often see when you go through a trauma, you develop PTSD, you get treated for it, there's this like fire and energy to try and either prevent other people that you know from having to go through this, or let them know that they can recover. So new possibilities in terms of volunteering within your organization, new possibilities in terms of career potential. That's public safety specific, but it's an area where, you know, your possibilities for your future can expand because of trauma. How post-traumatic growth happens is very similar to the PTSD model that I talked about before. We've got pre-trauma risk and resilience factors, the type of trauma matters, post-trauma risk and resilience factors, and what kind of mental health support is available. So I'm going to talk about the research that's out there. To be honest, this research is very limited, especially when it comes to public safety personnel. It's growing and it's wonderful. My dissertation research was done between 2014 2017, and the research that's been done since then is looking more closely at things that we were just starting to tease apart at that time. Post-traumatic growth is an area that's gotten a lot of traction in cancer survivors, natural disaster survivors, and is just starting to be applied to first responders as well. So this is a new area, but what we do know. Post-traumatic growth is partly based on your disposition, partly based on your personality. If you're, again, a more kind of agreeable, go with the flow sort of person, then you may be more likely to return to that and incorporate trauma into your world moving forward. People who are more optimistic about the world, more hopeful about the world, tend to report higher levels of post-traumatic growth as well. These things are not prerequisites. If you don't feel particularly agreeable, particularly optimistic, or particularly hopeful, which is relatively common in first responder populations, then don't worry about it. There's other ways to accomplish post-traumatic growth. But these are some personality traits where if you read these words and you think, oh, I'm pretty good at that stuff, then you may be more likely to develop post-traumatic growth down the road. Partly social support, partly mental health treatment. So what we see as being the most important component of post-traumatic growth across a lot of different populations is whether you're able to talk about how the trauma impacted you. Treatment serves that purpose for people. When a person comes to treatment, comes to sit down with a psychologist like myself and tells their story, we are going to process how it impacted you. We're going to process all your negative feelings about it. We're going to think about whether it's changed you for the better, for the worse, or whether it hasn't changed you at all. And you're essentially just going to talk it out. There's very important procedures that we do in these treatments that make it a successful treatment, but processing that experience is a really important component of it. You may be able to do that if you have good supportive family and friends. You know, there are quite a few relationships out there that serve the purpose of therapy without being in a therapy dynamic. So if you're really safe with your partner and able to talk about things with your partner, then that may look like processing, and it may look like coming out the other side feeling stronger in that relationship or as you move forward in life. If you're able to talk about things with your peers, do debriefings or organizational debriefings, informal or formal, you know, talking it out with your work partner, talking it out in a group based on who attended a call together, or critical incident stress debriefings, more formal debriefings. These things can be helpful too. The research is showing that a particular skill called mindfulness can be really important in developing post-traumatic growth. So this is the ability to kind of just be in the present moment, to not be ruminating about the past always, not be anxious about the future always. Of course, these things happen to all of us. Ruminating about the past, being anxious about the future is part of the human experience. But to spend most of your time in the present moment, noticing how you're feeling, not judging yourself for those feelings, but just noticing them. Similar is going for a run and noticing that your heart rate is elevated. You're not going to judge your body for having an elevated heart rate when you're running. You just notice it. And similarly, when you're at a traumatic event, noticing if your heart rate has increased and not judging it, just noticing. These things are associated with more likely to be well or to feel growth after a trauma. And then for public safety personnel, again, this is new research and there's not a lot out there, but what we're starting to see is how you feel about your work in the workplace is extremely important. And this is actually separate from what your organization does for you. Your organization could provide critical incident stress debriefings, but if you don't feel like they're safe places, then that is a difference there. So just the availability of resources is one thing and a very important thing, but your subjective experience of your organization as being safe, consistent with your values, something that you're passionate about, somewhere where you're supported, your peer group, your detachment, your unit, your partner, that these people are safe to work with. These things are extremely important to our sense of post-traumatic growth. So I'm going to give a couple examples because I think sometimes this can be fairly abstract. Now, I want to disclaim all of this that I am a psychologist, but the two examples that I give are not real clients. So they're hypothetical situations based on extremely common situations that I see in my work. They're kind of classic examples, if you will, of treatment. If I were to be training a student, I would hope they would get one of these cases because they are so frequent that they would then go on to be very comfortable. If the cases that I describe sound like your colleagues, I promise they're not, mostly because these are made up situations, but also because these are just very, very common experiences. And so you may identify with pieces of this, or you may think of a colleague immediately who fits the scenario. This is all just hypothetical and not breaking anybody's confidentiality here. So the first example that I'm going to give is a police officer. So say there's an officer who's been in service for 15, 20 years, is working mostly in traffic, and is experiencing a really high number of car accidents. Maybe it's been a terrible winter, or maybe he's just had bad luck. The car accidents are starting to stack up. Maybe there's been a few fatalities, starting to feel stressed, starting to feel a little burnt out in the work, and then comes across a car accident where one of the fatalities is a child who's the same age as a child he has at home. So this is an example of where an accumulation of trauma can happen, can be starting to get under somebody's skin, and then one event can sort of tip the scale where all of a sudden a lot of other car accidents may become intrusive in their mind, may start to have nightmares, may start to have flashbacks, may start to avoid either patrol or certain areas of patrol, may start to avoid doing file work because the file work is triggering trauma responses, and will likely be described as more irritable, have difficulty sleeping, and in their personal life may be socially withdrawing from their loved ones. So when this person comes in for treatment, and again, this is a really common experience, so it's something that I see a lot of in my practice, we'll have a few get to know you sessions where I learn about them and their career, they get comfortable with me. And then we may treat it through the prolonged exposure type of therapy that I talked about sooner, where we talk about that one car accident where the child reminded them of their own child. And the police officer will tell me the story over and over again until essentially your brain files that bad memory away in the past, as opposed to trying to keep it in the present. And so it feels less traumatic. Again, we don't wish that the trauma becomes a happy memory. That's unrealistic. We don't expect that the memory goes away completely because that's also unrealistic. That's not how brains work. But we can usually put that memory away in the past. And if you think about it, you might feel difficult feelings, but it won't be coming intrusively into your world all the time. And again, that's good enough. If that's where we get to with treatment, excellent, job done. But what I see with post-traumatic growth in this type of officer is that sometimes this officer might come back one day and say, it's interesting, I was actually talking to my wife about my job and realized that I'm feeling closer to her and more supported by her. I'm able to tell her more about the job because I'm not avoiding thinking about it all the time. She gets things a little more than she used to, and I feel more appreciated because of that. Or because of this call that I went through, I've just really realized how precious it is that I have the child that I do. I've been spending more time with my kid, and I don't know if I would have done that if I hadn't gone through this trauma. Or potentially connecting to the why he got into the job in the first place. Yes, you went through this one call or a series of accidents where there were fatalities, but in talking about that, maybe there's a realization that you saved just as many lives, or you've been able to support family as they process the death of a loved one and feel really good about how you supported a particular family. Feel really good about how you did the investigation into that accident so that family could get closure. And so the why behind the work is strengthened because of a particular call you've been through. Another example, and one I want to talk about because it's I get a little more pushback on the idea of post-traumatic growth from this population, is in corrections. So some types of trauma are more likely to develop in this feeling of, this is why I do the work. Corrections, I find people struggle with that. There's really high levels of burnout. There's really high levels of threat and risk. You're not saving children's lives every day. You're keeping yourself and your colleagues often safe while you're keeping inmates secure. And often inmates are quite violent or aggressive. And so this type of work is, if we think of types of trauma, I would suggest slightly less likely to naturally result in post-traumatic growth because it's a little bit less rewarding to go through. So when I get someone come into therapy from corrections, say they've witnessed an inmate attack a colleague and it was quite violent, or they've prevented an inmate from committing suicide and it was quite gruesome. Often with that comes a lot of burnout and a lot of disgust for the work, and the PTSD symptoms can be across the board. So their family says that they're more irritable, they're withdrawing from people altogether. And so trauma treatment here tends to look a little bit like, it can still look like the exposure therapy, telling the memory over and over again so that the memory itself becomes less stressful. But more than that, we'll do the processing therapy where we talk about the world more generally and try and balance out the black and white, bad people do bad things and I have to keep them in prison, So who else is out there in the world? Are there still good people out there in the world? Have you withdrawn socially so much that you don't have good people in your life anymore? How do we connect you back to the things that matter above and beyond the work? And are there values in the work that are important to you? You know, your connections with your support, your coworkers, or doing your job well, or the things that brought you in the first place. And so after trauma treatment, post-traumatic growth tends to look a little bit more like, because of trauma, I went through treatment and now I have this full life outside of work. I've learned that these things are important to me. Because of trauma in the workplace, I went through treatment, and then I noticed that one of my favorite coworkers had PTSD, and I told him about it, and he started getting trauma treatment, so I was able to help him. So it's less about, again, looking for the bright side and working with aggressive, violent inmates, and more about the periphery of your world. Aside from those interactions with inmates, what makes your life full? Can you connect more to that? What makes the workplace feel safe and secure? Can you promote that yourself? So different types of work will lead to different types of growth. Different personalities will experience growth in different ways. I could probably give examples for hours. You know, this is something that I see a lot in my practice, but those are two examples that will hopefully make this a little bit more concrete. There is growing work on identifying whether we can foster post-traumatic growth on purpose, and the answer is kind of yes. Again, when we think about how post-traumatic growth happens, part of it is who you are, part of it is the type of trauma you experience. We can't change those things necessarily when you come into treatment. The trauma was what it was, and your personality, extroverted, introverted, open to experience, or preferring to keep your world nice and small, these things are relatively fixed. We can shift them a little bit, but not night and day. So the things that we need to focus on then are social support, connections to peer groups, identifying safe coworkers to talk to, people who won't, you know, make fun of your experience or gossip about your experience with other coworkers. Your personal relationships, if you have close family, close friends, people who understand, people outside your organization, non-first responders that you can connect to, you know, people out in the non-first responder world who you can develop relationships with. And a supportive organization. A lot of work is being done to help organizations learn how to promote positive mental health and give people access to resources. At the macro level, that's important work. At the micro level, though, remember that each of you is part of an organization, and so contributing to an environment where if someone looks like they're having a hard day, not giving them the gears, or if someone tells you about trauma treatment, not minimizing that, you know, giving them a supportive space to talk about. These kinds of things build on each other, where you're part of a team and that team may or may not feel safe, but you can influence that because you're a player in that as well. Seeking treatment for PTSD is probably the most important thing you could do in order to potentially reach post-traumatic growth. Treating the trauma response is very important to feeling like your life has a way forward. Psychological treatment with a psychologist, with a registered social worker, through an OSI clinic, or through the online PSP net that I was talking about that CIPSRD has developed. Accessing a provider can be difficult, especially with the need for psychological services right now. Word of mouth can be really helpful if you have a colleague who's talked about treatment, or if you need resources, then going through CIPSRD can be a really helpful way to find somebody. And then there's some work being done on developing prevention programs. We're focusing more in the research on whether these programs can prevent post-traumatic stress disorder, but they may also be able to develop post-traumatic growth as well. So the before operational stress program helps people to connect to the things that keep them well and potentially reduce PTSD, potentially create a sense of growth after. And the road to mental readiness, which focuses on sort of a psychological first aid approach, identifying what it looks like to be experiencing trauma is part of your job. So some of you may be sitting here and still kind of shaking your head skeptically and saying, I don't buy it. I'm going to talk to two different groups of you here. If you are a public safety personnel, what I want you to come away from today thinking is that it is okay if post-traumatic growth does not seem like something you will experience. That's completely fair. You don't have to. Post-traumatic growth is not a requirement of recovering from PTSD. If your goal for yourself is to get rid of symptoms, I would suggest to you that is the goal for PTSD treatment. And post-traumatic growth is a cherry on top that a surprising number of people experience, but is not necessary to well-being. What I would say is that skepticism about things being good can actually be part of PTSD. So there's a certain quality of cynicism that anything good could be true that actually is a symptom of post-traumatic stress disorder. And so if you're wondering whether you have PTSD and you're also sitting here thinking that post-traumatic growth is impossible and a fairy tale, it's possible those two things are the same thing. So talk it out with a therapist, see if that's true for you, and if there are, there's really good treatments for it. If you're a treatment provider sitting here and a little bit skeptical about the idea of post-traumatic growth, this happens less often, but I have come across people who are concerned about the idea of post-traumatic growth. Not that it could exist, but concerned that this is an inappropriate target of treatment. Remember, the goal is not to discount real hurt, real trauma, real suffering in our clients. We're not the person who comes to therapy and says, you've been through something really awful, but have you considered looking on the bright side? I've got these wonderful rose-tinted glasses for you to put on. It's going to change your life. We're not here to push post-traumatic growth, but we are in a unique position of being able to watch when threads of post-traumatic growth start to be woven through therapy. Maybe someone starts to talk about talking with a peer that they didn't used to talk to, or maybe someone starts to talk about how they're grappling with religion because of what happened to them. And so as part of any good trauma treatment, we also need to pull on the threads that are positive, and this is a way to help to facilitate that without minimizing client experiences. So takeaways, and then we'll leave some time for questions here. We have treatments for post-traumatic stress disorder that work. They're empirically supported. They are accessible, they are based on good research, and they do work for the vast majority of people that go into trauma treatment, including for public safety personnel. For some people, above and beyond recovering from PTSD, trauma can actually lead to a sense of growth, better relationships, a better self-understanding, clear beliefs about the world, about how the world works, about your spirituality, and a stronger sense of purpose. This isn't a requirement of healing. It's okay not to feel these things. It's okay to wish that your trauma didn't happen, but given that we can't erase the trauma from your past, potentially there's a way to move forward with purpose. And the way that we can do this is through psychological treatment, through peer support, both formal and informal, personal social support, and connecting to that why. What values brought you into the work? Was it helping other people? Was it having stability for your family? Was it a desire to do good? And connecting to those things and reapplying them to your career. Okay, thank you very much.
Thank you so much for that wonderful presentation. I know I learned actually quite a bit, so that's exciting. Always exciting for me when I get to learn something from this. I do want to open up the floor to questions. So you can go ahead, as I said before, and submit them through the question box, or you can raise your hand. I'd be happy to unmute you. We do have one question, and you might not be able to answer this just based on your experience, or also because you've been away for a bit, but can veterans still self-refer to the Operational Stress Injuries Clinic?
I believe so. That's an awesome question. I'm pretty sure that they can, but I think the process has to be going through Veterans Affairs. So it's, unfortunately, I'm not going to be able to provide a very good answer about that. If you call the OSI clinic that's closest to you, they'll be able to tell you exactly how to get into the clinic though. So whether that has to be a referral through a doctor or through a Veterans Affairs caseworker, there's OSI clinics in, I think, every province now, just about every province. So you can call your provincial one and they'll be able to direct that answer.
Okay. For people whose symptoms don't reach a diagnosable level, is post-traumatic stress, or post-traumatic growth, I should say, something they can still reach or attain even if they haven't reached that symptomology level?
Yeah, absolutely. There's two schools of thought here. So there's a school of thought that perhaps kind of surprisingly, but maybe given the presentation less so, the higher your post-traumatic stress symptoms, the more likely you are to develop post-traumatic growth. So again, if we think about that foundation shaking, if it's just a little earthquake, we don't need to rebuild. We don't need to examine our beliefs. We don't need to connect to our social support. We call it a bad day, maybe order pizza that night and move on with our lives. But if it's a really severe trauma, then we're more likely to do this kind of exploration about ourselves and the world that leads to growth. So if you think of that on a straight line, there's still this middle gray area where you don't have a diagnosis of PTSD, but it was bad enough, if you will, that you re-examine yourself. I would also suggest that above and beyond trauma, there are people who are more likely to reflect on themselves and to thinking about the world and to do the sort of work that we do in therapy naturally. You know, people who wouldn't come to a psychologist because they think along the lines of a psychologist anyways. And so those are the types of people I would expect have some trauma response, maybe nightmares for a few weeks, do some reflecting, and come away with a deeper understanding of the world. So I would suggest that, yes, absolutely, not being diagnosed with PTSD doesn't mean that you can't have growth.
Okay. Are there any books about post-traumatic growth that somebody who's maybe a researcher or a clinician can access?
There are quite a few, actually. For a client, I would actually recommend let me just look it up here. Maybe I can put it in the chat. Is the chat available to everybody?
Yeah, you should be able to just switch it to be for entire audience.
Okay, maybe I'll see if I can figure that out here. Well, I'll say it out loud, and then if you want to read it down, you can. So the PTSD workbook, it's got a blue cover. It is one of the best workbooks that you can use if you're a client. And it's got a section
screen at the moment. So.
Oh, yeah, okay, well, there you go. Yeah, okay, great. Of course, because I'm sharing my screen. There it is. So you can take a look at this workbook. It's got a section on post-traumatic growth as well. In terms of research, there are a few summaries, but again, not so much. There is a post-traumatic growth handbook that's good, but it's a few years old now. So because the field is still growing, less in terms of books, more in terms of research, but it's one of the few areas where if you Google post-traumatic growth just on Google, the results that come up are actually very good. So there's not a whole lot of like bad blogs and things out there. It's actually good information. So it's a good place to start, just looking on the Wikipedia page and going from there.
Okay. People are just wondering if you'll be willing to share your presentation slides.
Of course, yeah, absolutely.
Perfect. So then we will put them along with the video onto our website, probably tomorrow, maybe Monday. And so they'll be available for anybody there who wants to access them. And it looks like I don't see any other questions at the moment. Please, again, if you want to raise your hand or put in a question, go ahead. I'll give you a little time to do that. I noticed that you gave an example from police officers and from corrections. One of the areas that's really been strained recently that we've noticed is paramedics. So do you have like an example that you could give on the paramedic end of things, just to kind of like round out the examples that you've given?
Yeah, absolutely. Paramedic work is complicated because you come across so many different types of traumas. Of course, that can be true for other first responders too, but when I see paramedics in my work, what I'm often struck by is the buffet of traumas you can experience in one single shift. And I know that COVID has made it complicated with the emergency room situation, because you might experience a really stressful traumatic event and then be essentially waiting in the hospital with that patient instead of be able to go back out onto the road. So then you're hearing about your coworker's stress, and there's so much time pressure, of course. I think one of the things that comes out of this more easily than some other work is that for every call where something goes bad, there's a call where you save a life or you change someone's life for the better. So in my experience, and of course I haven't seen every single paramedic in the province, but in my experience, post-traumatic growth can actually occur relatively quickly in this population, because they have a lot of examples to counterbalance that when you do your work, there's potential to save lives, there's potential to do a lot of good. People, not always, but can be quite grateful and can be saying their gratitude to you as you're doing the work, as opposed to someone who's an investigator and may never hear from the family on the other end of an investigation. And so with a paramedic, I would almost highlight more clearly that post-traumatic growth is probably quite likely for you, but you have to get PTSD treatment. You see too much. And so post-traumatic growth is lovely. Focus on finding treatment. You're covered by workers' compensation. We have treatments that are very, very effective, even for this type of diverse accumulated trauma that happens in like the same shift sometimes.
Sure. So we have a question. What do we do as PSP for recurring PTSD?
Yeah, that can happen quite a lot for people. As a provider, not to be too flip, but what I would say is have a good relationship with the therapist so that you can have a thread of continuity over the career. I've been in practice in Saskatoon for 5 years now, and so I have some people that I saw for a year or two at the beginning of my career who check in with me once a year, or who will come see me when there's a trauma that's threatening to kind of come to the surface again. Going through PTSD treatment can prevent recurring PTSD or make it less intense or less likely to unravel, because you know what to look for. So if you're having recurring situations of PTSD and you haven't received good empirically based treatment, again, not to be a broken record, but that's really the place to start, because it can help protect against PTSD down the road just to have gone through treatment in the first place. On a practical level, try not to avoid, try to find ways to process what happened to you. Putting things away in a little box and trying to lock that box at the bottom of the ocean does not work. It almost always comes back and hits you with the 5 times force. And so a simple and very difficult thing that you can do is drive past the intersection where the accident happened. Do little pieces of exposure insofar as you can with yourself. You know, there are plenty of people whose symptoms are so severe that you need psychological support to do these incredibly difficult things. But if you're able to approach rather than avoid, then we can do a lot to reduce that PTSD. And sometimes in some careers, there are slight shifts that can happen that make you less likely to develop trauma down the road. So if you're in corrections, maybe you get into a management position. If you're in the RCMP, maybe you change detachments or you change type of work. So if the organization is important to you, the work is important to you, treat the PTSD, and then there may be some creative exploration about how to make the organizational work for you without causing you damage as you help other people.
Yeah, perfect. So it looks like we don't have any other questions other than some thanks and appreciation in the chat, which I will share with you now. I'm just going to go ahead and I'm just going to take presenter control back. I'm going to share my screen for a moment, just because I want to remind everybody that June 27th is Wear Teal Day, and that is for PTSD Awareness Day. So whether you want to throw on a ribbon like I have today, whether you want to wear teal, we hope that you will join us in supporting the awareness, and we are working to get stigma out and understanding in when it comes to PTSD and all post-traumatic stress injuries that PSP can go through. I want to thank you so much for being here today with us, Dr. Horswell, and as well. I want to thank everyone in the audience for this great session. We ask that you fill the quick survey at the end of the town hall out, and we hope that you can do that for us. We enjoy your feedback. We host monthly town halls on topics that are specific to public safety personnel. So if there's something you want to learn more about, let me know in the survey, and I will work to get a speaker for you. The next town hall is going to be on August 18th. We do take a break kind of over the summer, but we will be spotlighting training with information about R2MR and ER2MR, which is new. So a link for that will be in the follow-up email, along with a link to the video recording for today. And once again, I want to thank everyone for attending today. I want you to take care and stay safe. And thank you again so much for a great presentation.
Thank you. Everybody.